Now, inevitably, women have to take antibiotics, and that can be for bladder infection, bacterial vaginosis, it could be for respiratory infection, it could be surgery, whatever. And so there's a concept out there, it's been there for many, many years, that if you take antibiotics, then you have an inevitable chance of getting a yeast vaginitis. Well, that's not necessarily the case, and some of the newer antibiotics, in fact, have a low incidence of yeast infections taking place after taking them. So we did a study of 12 women where we gave them 10 days of antibiotics. So they had respiratory problems, they had throat problems, and they were given antibiotics. And we then gave them Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14 during the antibiotic treatment, and they took it right after the antibiotics were finished for an additional 20 days. And it turned out there was no cases of yeast vaginitis, no cases of urinary tract or bacterial vaginosis at the 1 month follow-up. And, as you'd expect with probiotics, there was no antibiotic side effects. Then we took another group of women that were actually randomized, and they took 10 days of antibiotics plus placebo for a month. Well, it turns out again there was no cases of yeast vaginitis, sort of adding to this belief that in fact yeast may not be as big a problem as we think. However, 25% of the patients developed bacterial vaginosis by the end of the month. And it turned out that the probiotics had prevented this disruption of the vaginal flora. So if you take an antibiotic, it goes into the bloodstream and acts in many parts of the body. You obviously would like it just to act in the respiratory tract, in the lungs, or in the throat, or in the bladder where you have the infection, but that's not how they work. They have a sort of effect right over the body, and that's why you have antibiotic side effects. It turns out that lactobacilli can prevent some of the side effects, like diarrhea, for example, because if you can imagine an antibiotic, it's like a stealth bomber. It just comes in and carpet bombs all the organisms that are there, and it doesn't really care whether you're a good bacteria or you're a harmful one. It'll just wipe them out. And we use anywhere near the same amount of antibiotic. And so we're still studying this concept right now. But the one thing to remember, if you take a probiotic with an antibiotic, you should probably take it about an hour or two apart, because some of the antibiotics will kill the lactobacilli in the stomach, and you don't obviously want that to happen. So the advice is take the antibiotics, 1 or 2 hours later take the probiotic, continue taking the probiotic after the antibiotics, and hopefully you'll get an improved resolution. And by all means tell your physician that you're doing this. The physician has advised you to take the antibiotics, and you should not do anything that is not recommended by the physician in terms of the antibiotics. You should take them right through to the end of their course. But what we're saying here is that supplementation with lactobacilli may also provide you benefits.